Hello, viewers. This is Dr. Hassan live with you. This live is brought to you by Track Medi Services and Rainbow Children's Hospital, Bangalore. As you know, every show we bring some renowned doctors from different countries with us of different specialties. This week we have a renowned child specialist with us from Rainbow Hospital. Well, about Rainbow Hospital is one of the largest tertiary pediatric healthcare organization in India. And this evening we have Dr. Manu Choudhury with us. So, how are you, doctor?
Hi, I'm good. Thanks, Hassan.
Thanks for joining. Thanks for joining the live. Dear viewers, let me give a brief about Dr. Manu Choudhury. She has done her MBBS from Armed Forces Medical College, Pune, and then she pursued for her residency from Children's Hospital of Michigan, United States, and she has done 3 years fellowship in pediatric infectious disease from Texas Children's Hospital, Baylor College of Medicine, United States. Her externships were at the Harvard Medical College and Mount Sinai School of Medicine. So viewers, we're going to start our discussions now. If anyone have any questions, can write to us in the comment box directly. So doctor, before going to the main discussion, I would love to know about the COVID situation of your city. As you know, it's pandemics going on.
Sure. Thanks for the introduction, Dr. Hassan. So, just like Bangladesh, even the cases in India are increasing still. We probably will end up being in the top list soon with the numbers rising. Even in
Hmm.
Bangalore, we are seeing a lot of cases rising.
Yes.
For me, I'm leading the COVID task force for my hospital, being an infection specialist. So we are seeing a lot
Hmm.
of cases, but
Hmm.
fortunately, kids are handling it pretty fine.
Okay. So things are handling very nicely over there, inshallah. Okay. So let's get started in our main discussions. Uh, so you are a pediatrician and you deal with the infectious disease of the children. So what are the common infections in children? Can you tell us?
So some of the common infections, and we can go head to toe, is which we see in our young kids is infection of the eyes, which we call pink eye, runny
Mm-hmm,
nose, sore throat, so tonsillitis, ear infections. Sometimes
mm-hmm.
their lymph nodes can swell up, swelling here. Some
Yeah.
can have prolonged cough, and so which causes pneumonia is the word used.
Mm-hmm.
Sometimes they can get urine tract infections as well, and then common skin and soft tissue infections we see very commonly in our OPD practice in children.
Okay. So how to differentiate the nose allergy from infection? Is it a nose
Yeah.
allergy or is it an infection? How can you differentiate that?
Sure. So I think that's the one of the commonest reason why patients, parents get their children to the hospital is my child has always have had runny nose. So some of the distinct features of allergic nose is they usually have clear nasal discharge and they'll probably not have fever. And
Mm-hmm.
usually the runny nose and sneezing is early in the morning, or they might have dry cough while they sleep, because then the secretions of the nose, the swollen
Mm-hmm.
nose, it drifts back, scratches the throat, and they'll have coughing. So usually nose allergy is if you don't have fever, it's clear discharge. Whereas if you have a little bit of viral or bacterial infection, you might spike fever. The If it's a bacterial infection, then the discharge becomes more yellowish greenish, so that means it's getting infected. And then if your fever is lasting, then your child might need antibiotics as well. So those are some of the differentiating features.
Oh, so that means when there will be a bacterial infection, the color of the discharge will be yellowish, and if there is no bacterial infection, then it will be as a crystal clear or
Clear.
something like
Yeah.
that.
Yeah. Yeah.
That's good. So does every infection requires antibiotics? What do you say?
So very good question, Dr. Hassan. So most of the infections in less than 5 years of age children, especially both in India and Bangladesh, are usually virus related. Actually, all over the world. Okay, and a virus, you don't need antibiotics, and there's rampant use of antibiotics in these age groups. So usually, I would like to talk about viral infection in these age groups. So they usually start with a little bit of runny nose, congestion, mild cough, some temperature, and most of the viral infections will get better within 3 to 4 days. If the
Mhm.
fever is continuing beyond 3 days, or if the runny nose has become more yellowish and your child is looking sicker, that's when the child probably has a bacterial infection and needs antibiotics. So it's germs, which are because of germs, particular type of germs called bacteria, that's where we need antibiotic. Not every runny nose, cough, cold requires antibiotic. So the message here is to please check with your doctor, ask them if the antibiotic is really needed for their child.
Yeah, that's good because in third world countries, what we are practicing that most of the antibiotic you can see, as you state in the United States, they are using only the amoxicillin still today.
Yes.
But in India and Bangladesh, amoxicillin, I think it has gone resistant.
Yes,
We are
yes.
using the
And
third
this is
generation
the
syphilis
reason.
for India.
Absolutely. And this is the reason. And, people just go over they go. And actually, some of my patients' parents will refer to the old prescription and start the antibiotic. Even that is a
Mm,
bad practice. So,
that's a very bad.
always see your doctor or do a video consultation before committing your child to a antibiotic.
Okay, that's good. So when to seek a medical help when my child has any cold and cough?
So most of the time, if you do the home remedies where we give lukewarm water, ask our children to do some salt water gargles, have those milk with turmeric, all those home remedies, Ayurvedic home remedies, totally
Ayurveda,
fine.
yes.
Yeah, or Unani, those basic home remedies which parents and we've grown up with. Yes, if the fever continues beyond 2 days and they're high grade fever, or if your
Mm-hmm.
child is not, not behaving his usual self, so little bit of low energy will be there because they have virus in their body and they are feeling sick. But if they're drowsy, you're not able to wake them up, if they're vomiting a lot, so they're not maintaining hydration, in those cases definitely seek medical help. And if any doubt, I think, I'm sure video consultation would be available in Bangladesh as well. Am I
Yes, yes, yes.
correct? So just do video consultation, ask your doctor if you need to bring your child home, to the hospital or not.
Okay. So, any specific food choices to avoid infection in the children? Because
Yes.
when nowadays also the children are having the junk foods, and they don't love to eat the regular food. They love to eat the junk food, pizzas and all. Is there any specific food
Absolutely.
choice? Any
So
specific food
this is,
choices?
yeah. So this is again a very common question. What can I give my child for immunity boosting? Okay,
Hmm.
and my
Yes.
message to parents, and there are like a lot of over the counter stuff which they call themselves immunity boosters. So message to all the parents is that, if you give your child healthy local produce seasonal food from your community, that's the
Hmm.
best food, that's the best immunity you can provide your child. There
Okay.
is with this staying at home and not going to school, the children are like, more focused on now having junk food and processed food. Again, that is not healthy because it's been processed and been in package for a while. And I see like there are younger kids like 3 years old getting chocolates every day. A toddler is not going to go to the to the shop and buy these things themselves. So when parents tell me no, no, I have to give him, I just don't, I get very upset because it's the parents duty, because the child does not understand in long term how it's going to affect their health. So please, please, it could, you can't take away all the joys of childhood. That's what I tell my parents, patients parents. But make it like once in 2 weeks kind of event, or just pace it out. And one of the biggest reason, which I have come across ever since I've come back to India, there are a lot of throat infections, and the reason is a lot of these young kids have big tonsils. Okay, so
Hmm.
these are like special organs. They are our first fighters when fighter of infection in our body. So they are big and they have these puddles. So when you
Hmm.
eat chocolate, when your child eats chocolate or anything sweet, the sweetness, all those sweet products, they get stuck in those puddles, and
Okay.
you normally have a bacteria in your mouth, so the
Hmm.
bacteria overgrows because now it has sugar as his food. So when it
Exactly.
multiplies, that's when you get these common throat infections. So lot of my kids who have recurrent throat infections, I this is one of the thing I eliminate. So a lot of sweets is totally out of the picture. Brushing at night, I think, is the other big thing which I had to like really grill in India. And then third thing is every time they eat or drink something sweet, follow it up with water, so that way the puddles are kind of cleaned. So
Okay.
teach your children to swish, and then they can wash out that sugary stuff from their mouth. And the last thing is, they give bottles to bed, right? So milk bottle, and I remember very distinctly, even my brother used to get those bottles to bed. I think that's another habit we really have to get rid of, because milk in itself has sugar. So I usually say, if you are struggling to get rid of the bottles, then have an extra bottle of water, so that once they're finished, you can just give them water to suck on, so that it's cleared up, the milk is cleared up from the gums and teeth. So
Okay.
those are some of the dietary precautions parents can follow up.
Okay. So one question for me actually. So I'm not a kid. So can I have chocolates because my fridge is full of chocolates. So
I think you can have I think everybody can have chocolates. It's the
okay.
excess of something which is concerning to me. And
Okay.
and then brushing at night, I think everybody should do it for their own oral hygiene, and just have a sip of water after you've had anything sugary. So I'm not saying don't give chocolates. I think I love chocolates too. So
Me
just
too.
don't do it in excess.
Okay. Okay. So what are the warning signs parent needs to know regarding an infection? What are the signs actually?
What are the signs? So
Yes.
usually, any infection of
Mm-hmm.
anywhere,
Mm-hmm.
it will start with some discomfort. Okay, so if it's throat, it
Mm-hmm.
will have, the child might not, so younger kids might not be tolerating food, they might be vomiting. If it's eyes, then they'll have watery eyes, they're rubbing their eyes. Ear pain, they'll probably be crying a lot. And
Mm-hmm.
stomach pain, stomach infection, they'll start vomiting or having
Mm-hmm.
loose stools. So those are some of the indirect signs. Also, they can have fever. So if they start having fevers, and actually both viral germs or bacterial germ infections can look very similar. So usually your doctor might help you differentiate between the two and then decide on the antibiotics. So
Okay.
these are some of the subtle signs which parents can pick up on. And then you can get a mosquito bite and it does look red and inflamed, but most of the time, it will settle down in some time. It's probably just an allergy. So some
Yep.
kids have very sensitive skin, so they'll have swelling, but if you ice it up, it gets better. But if it's spreading, if it's painful, you touch your child's skin, that area, and it's very painful, then it
Yes.
could be a skin infection, and then you need to seek medical help.
Okay, so firstly, actually, we have to wait and see that what's happening. Then we have to go for the professional.
Help, yeah.
comments
And
help.
what
Yes.
I usually say, in this age of technology, please take pictures, please take videos. So if you have doubt how your child is breathing while they're sleeping, or they are coughing once in a while and you're still worried about it, just take a picture. If they're vomiting, if they're pooping, I've seen all kind of poop colors. Okay, so I tell my patients' parents, just take pictures. It's amazing. It just, and make diaries. So I call them symptom diaries. So that way, instead of you recalling every time what happened in the last 3 days, it's
Mhm.
usually you have a record. You just share it with your doctor. Hey, this is the time date when my child had fever. This is what I did. And that way I have more subjective evidence, objective evidence to go by. And depending on, like, oh, the fever is continuing beyond 3 days, I need to think of bacteria infection, I need to do blood test or urine test. So that really helps a physician. So keep that symptom diary.
So we have to keep the records. The parents, we would ask parents to keep the records actually. Okay.
Yes.
So what are your thoughts about over-the-counter medications and antibiotics, OTC
I
medicines and
am
antibiotics?
so against it. So in US we were like, there's no field where you can get over the counter, even amoxicillin or penicillin. So you have to have a prescription, and I think it's so easily available here. And we see all these very resistant organisms, and parents who have healthy children would probably just use it once in a while over the counter. But it spreads, the resistance spreads in the community. So the resistant bugs we see in the ICUs, so it's little babies who are getting sicker with these very bad bacteria where we don't have any choice. So I've managed some of the patients in ICU, these newborns, premature newborn babies. There is no antibiotics, so it's a bacteria where I have no choice of any susceptible antibiotic, and I end up using 3 4 cocktails. Sometimes I'm able to get them out of that infection, sometimes they lose their life, and that parent. So it's very very important to know for everyone. Please do not
Mm-hmm.
go for over the counter antibiotics. And it can harm your child as well, because I've had children coming in with drug allergies. So the whole face and body breaks out in a rash. Okay, and this is basically they have antibiotic allergy, and it
Mm-hmm.
was just a
Yes.
viral infection. And there's some actually viral infections, so like mononucleosis. If you give them antibiotic, they'll break out in a rash. So
Yes. Yes.
and they can
Yes.
develop diarrhea, right? So they can have these bad loose motions, even blood coming out of their in during their motions. So that's another side effect. So everything has its own side effects. So when it's very very important that a recognized physician is prescribing your child antibiotics.
Actually, I'm also against the over-the-counter drugs. I don't like it.
Yeah.
Anyway, so what are the some infections parents can manage at home?
So some of the infections, so common cold, right? So that's
Yes.
basically a little bit of fever here and there, clear runny nose, mild cough. I think those can be managed very well at home. Focus on hydration of your child. So there are these ORS Tetra packs. So in our times, we used to have those WHO sachets, and they tasted horrible. So now they have these amazing Tetra packs which are orange or apple flavored. So the parents can go and buy those for their children, keep them rehydrated so that they can wash out the infection faster. Do lukewarm water, do salt water gargles for the sore throat. If there's little bit of runny eyes, don't worry about it. Just you can use artificial tear drops for the irritation. But if there's pus coming out, you need to see a doctor, because that needs antibiotic ointments. So those are some of the skin infections. You can just manage at home with some topical antibiotics. But if it's spreading, if it's pus being formed, then you need to see medical a physician for your patient
Okay.
child's care.
For using the topical antibiotics for the children, is there any harm? Rather, is there any harm?
So again, I think if you've seen your physician once, or if you have done video consultation and they've told you this is the topical antibiotic you can use for mild soft skin infections, you can use that. But then everything, it gets absorbed in the skin. So if you keep doing it too often, it can develop resistance, or it might even get in the bloodstream and cause infection. And they are like these combinations of topical antibiotics. So it has steroids, it has gram negative, it has fungus. So there's these concoctions which are like not to be heard of, like everything together. So they can harm. So, and you can have allergies, right? So you might use
Yes.
all these neomycin with some aluminium. They can cause you dermatitis, skin infection, skin allergies. So always it will be better, like at least one medical attention you can seek. And then eventually, like, you'll learn. Your first child, you'll be probably seeking video consultations and going to your physician very often. But by your second child, or by your first child growing up a little, 3-4 years old, you kind of get a hold of what are mild infections and what are serious infection, for which we need to go to our doctor.
Yeah. In what subpopulation fever should be raised concerns and medical help should be as sick or what?
Sure. So as we said, yeah, mild infections, we can try managing that at home. But there are some populations like children who have diabetes. I think
Mm.
those, even little bit of fever, little bit of you know complaint in the stomach, I think we definitely need to see a medical physician. The reason being, they might not provide the whole spectrum of how a sick child look, and they have very less reserve before they get really sick, where they might have to be seen in an ICU. So a diabetic child, a child who has cancer and he's been on chemotherapy, so that's another subpopulation. Third is very obese children, because obesity leads to your decreased immunity. So obese children with mild cough, wheezing, you need to seek medical attention. And any children, so like who have joint problems, or skin problems, where they are on immunity suppressing medicines, so like steroids, or there are other immunity suppressing medicines. Those children might not provide the real spectrum of high grade fever, looking unwell immediately. They might have these subtle signs which the parents need to notice. So those children, we definitely need to seek medical help instead of just waiting those first 2 3 days to manage at home.
Okay. So, what does a parent need to know about COVID-19 in children?
Sure. So, lot of information out there on the media, on social networking sites, and I think most of the parents are aware. But there are some updates which I would like to share. First of all, initially it was thought that this infection, the surfaces also is a very high mode of transmission, where parents were even washing their vegetables and fruits with detergents, which was crazy. But I think now, with new knowledge, we know that the
I also
most
did it once.
you did that. Yeah,
And
but
the
like
first time, actually, 2 3 months ago. Yes.
yeah, because they're porous, right? So if you wash
Yes.
it with detergent, the
Absorbed.
detergent goes in,
Absorbed.
and
Yes.
then it can cause issues. So, but now with the latest information, we know the most typical way this virus is spreading is through droplets. So you basically are breathing, somebody who's sick coughs, or laughs or whatever, and then these droplets can travel within 3 to 6 feet, and that's when this infection is spread. And hence the reason for wearing a mask even when you are not symptomatic, because there are cases where they are not symptomatic but can still transfer the infection if they have the virus. Okay, so it's the main. And then the second is airborne. So airborne is basically, it can the droplets do not stay in the environment for long, they probably settle down on the surfaces. But airborne is when somebody who has the infection sneezes or coughs or in a closed space. So in those cases, so we need to be careful in those spaces, closed spaces of patients with the infection. And that's more relevant, the airborne precautions are more relevant for doctors, because we do some procedures where the airbornes are generated and it's in a closed environment. But for everybody else, the parents need to know it's usually through the droplets. So please keep your child with mask. And below 2 years, they're not going to wear a mask. Okay, so don't even stress too much on that. But at least older than them, have their toys wear mask. You guys wear mask when you are stepping out of a house and in a crowded space. I don't recommend parents to, if you are going for a walk in an open area and there are people spaced out, I think it's fine without a mask. But if as soon as you come in contact with somebody within 6 feet, a mask is a necessity. And fortunately, COVID in children is very well tolerated. So most of the patients I'm seeing are very mild with mild symptoms. So they'll have fever, mild cold cough, little bit of vomiting, and it's last 2 3 days and then they get better. Okay, so kids are doing
Okay.
well. There are very few cases where they get sicker, where we manage them in the ICU and they do well. Even those are doing well. So I haven't lost. So we have managed around 150 children, around 150 children, and all of them have
Hmm.
fared well. But
Okay.
the important thing for here is you cannot ignore because some of them can get sicker. And then they
Okay.
are source for elderly. So it's most important to shield the elderlies at home who have diabetes from their children. So yeah, so those are some of the points about COVID in children.
Okay. Previously, who said that the asymptomatic patients don't spread the disease? Is that true? What do you trust it? Do you believe it?
What can you repeat once more?
Who said the World Health Organization said that the asymptomatic patients of COVID, they are not spreading the disease.
No,
So
no, no. So there have been enough studies now. Even asymptomatic carriers are can be a source of infection to others. So they don't
mhm,
know. They probably are pre-symptomatic, but
mhm,
they have viruses in their nose and throat, and they can spread. So that's why this whole concept of mask, wear a mask all the time, and it's such a cheap vaccine. So
yeah.
maintaining those 3 to 6 feet and wearing a mask, even for asymptomatic carriers, is very very important. So asymptomatic carriers do spread infection.
Okay. Actually, the doctor is saying that when a child or an adult is infected in COVID, I mean coronavirus, it's better to stay home rather than to going to the hospital. So, what do you think? When to see the doctor?
Yeah, yeah. So I think COVID is like any other virus, but in some population, it can make them really sick. And some of those population are the ones I talked to you about. So patient with diabetes, patient with immunity problems, patient with asthma, so underlying lung disease, they there it can be really sick. So let's talk about children. So most of the children can be managed at home with proper oral rehydration, checking their oxygen levels, so it should be more
Mm-hmm,
than 95%,
mm-hmm, mm-hmm.
controlling their fever with fever medicine, avoid combination fever medicine, just paracetamol or acetaminophen, whatever brand it comes in with, that. At any, know the warning signs. So if they, if they have difficulty breathing, they're vomiting, loose stool, rash over the body, red eyes, if that is happening, go to the hospital. But as you
Mm-hmm.
said, most of these children can be managed at home very well. Okay. Coming to adults, adults behave little different because they can
Mm-hmm.
get sicker faster there, and them in them it impacts the lungs more than the children. So elderlies, I think we need to be very careful. Again, most of the elderlies handle it fine, but if they are developing chest pain, their oxygen level is falling, then immediately seek medical help.
Okay. Uh, in COVID situation, we have to keep the patient isolated, right? But it's very tough to keep the isolated a baby. Okay. So, how to do home isolation in COVID positive patient at home,
So
especially for the
COVID
children?
home isolation usually. So usually we are saying anywhere from 10 to 14 days they should be in a isolation till their symptoms are over. Since the first test they were done. So what I usually say is choose a room which has good ventilation. That way they
Mm.
don't feel suffocated in a particular room. A room with a window, a room with a balcony. Okay, if they don't have that, the child or the parent who is taking care of the child during that time, both wear a mask and take the child to the balcony with the mask, and then they can have little bit of usual time. If it is a teenager who is there in that isolated room, then they can have video consultations, like video calls with their friends, so that they don't feel, because it is causing a lot of psychological stress as well, this isolation.
Okay.
They usually have their different utensils assigned to them. The laundry is done as a segregated laundry run for these particular days. And then most of them again do very well. So those are some of the tips about home isolation, because people freak out like sitting in one room. I just can't imagine. So I counsel my parents and patients to do some of these things so that they don't get psychological stress out of getting out of infection, but now going into depression or anxiety related to isolation.
Okay. People are saying that, I mean, I can hear from a lot of people that they're saying that the in isolation room air condition is harmful. Is that so?
So I think there have been a lot of to and fro about this whole air conditioning. Does it increase the virus load? Does it decrease the virus load? So what a lot of units are doing is, it depends on air exchange. A lot of these ACs have HEPA filters, so that will get rid of most of the virus. So I think if it is a dedicated AC, I don't think we need to worry about. It's fine. And just leave your room once in a while to open air with your windows open with fan running to get rid of, even if there was some suspension of the virus in the room with a coughing family patient or family member. But as such, there hasn't been a great proven study saying ACs are harmful and spread to the infection, because there are a lot of air exchange that happen, and most of the air is pushed. Once it's sucked out of the room, it pushed out in the environment, and a new circulation of air is taken in, and there is very less recirculated, less percentage of recirculated air. So I
Okay.
would say not highly that an AC will contribute to the spread of infection.
Okay. Is there any medications that you cannot use in case of COVID? Like any specific medications that you cannot use that? Like in dengue, you cannot use few things. Like in dengue.
Yes,
So,
yes.
is there any such medicines that you cannot use in
So
COVID?
usually that's even in COVID, we are saying avoid mefenamic acid and ibugesic. Try to control the fever with the cool sponging and acetaminophen. The other thing was there was a lot of rampant use of hydroxychloroquine, and with the new studies we know that it's not really
Not
much
not helpful. Yes. Yes.
contributing to. So most of my patients are actually they're recovering with just symptomatic care where I'm not giving them any medication. The kids who go to ICU, who
Mm-hmm.
have lung issues where they were intubated or they needed oxygen, in those cases I might use a medication which we call remdesivir. So that's a
Mm-hmm.
known antiviral in the disease process which has shown to help. So that's the only IV or antiviral medication I'm using for my patients, and maybe steroids based on like how they are behaving. But none of my outpatient or home isolated patients are on any kind of medication. So even I've seen there's a lot of rampant use of azithromycin. So even that I'm not using unless I think there is a very strong
Hello. Yeah, I can hear you.
yeah. So though that's what, like, very few medicines I'm using, and there's a lot of combining of medications, and especially in elderlies. And if we combine a lot of these hydroxychloroquine, azithromycin, ivermectin, I don't know what not, and their own medications, it can actually lead to abnormal heart rhythm. So that's really scary. Like, we've lost people to what we call arrhythmia or abnormal heart rhythm. So be very judicious with what medications you're taking during these times.
Actually, maybe azithromycin was used in that concept that it helps in upper respiratory tract infection. That's why I think the doctor suggested that previously. I
Yeah,
think it's
yeah,
not helpful though. Still,
yeah. So basically, what azithro is, it decreases the inflammation in your lungs as well. So that was the thought process. But I think none of the studies so far have revealed its benefit.
okay. So, what is MISC?
Okay, so there is a condition called a multi-system inflammatory syndrome related to COVID. Okay, and a lot of articles are being wrapped up, being published regarding COVID impacting the heart of the children. Okay, so it's basically what happens is the child had at some point active COVID infection, so they had runny nose, cough, cold, or mild fever, or they were asymptomatic carriers, and then they develop antibodies to that COVID. So they have what we call antibody serology test positive. Okay, and there is some process that happens in the body that our body reacts too much to these antibodies. So the body starts producing all these chemicals which start harming our own body. So the one of the very important organ which is being hurt is the heart. So the heart might swell up, so the child may feel difficult to do daily activities. The blood vessels supplying the heart can swell up, so that's called Kawasaki disease. So a lot of pediatrician might be already seeing these patients. There'll be redness in the eyes, the lips start turning red, the palms and soles and the whole body break out in some kind of rash. They might start having a lot of vomiting and loose stool, and they just look sick, and they have a lot of fever, like every day they have fever. So this is what is multi-system inflammatory syndrome related to COVID. And
Okay.
the other word for recently used in Europe is PIMS. So a lot of cases have been reported from UK and England, UK and US, and now we are seeing that as well. So in India also we are seeing, and we are managing as a team here in India, in Bangalore, in our Rainbow Children's Hospital. Most of these kids do very well if we pick up this condition, and it's usually pick up with a battery of blood test and ultrasound of the heart. if you get your child at the right time, so that we can do these battery of tests, we can give them a special medicine called IVIG, and they respond very well to it, and most of them do very well, and they get out of it, and they are, you know, are in our follow-ups now. So almost like, I would say, 4 5 we have managed in the last 1 month, and they're all doing
Mm-hmm.
well. So
Okay.
something parents need to be aware of, that yeah, my child was asymptomatic, the whole family got the infection, but the baby was totally okay. But 4 to 6 weeks later, the baby now starts having a lot of fever, red eyes, red lips, fever not improving in 3 4 5, 6 7 days. Then please
Okay.
think of this condition, and mostly your pediatrician will think of this condition
So when to see the doctor immediately? What conditions?
immediately. This case, if your child has any of these symptoms, where they have red eyes, red lips, strawberry tongue, they're vomiting a lot, they're drowsy, not feeling well, it's been already 3 4 days of high grade fevers, definitely see your physician immediately.
Okay. One of our viewers said, "Good to see Dr. Hassan and Dr. Manu. Thank you so much." And one of our viewer asked, "Give a suggestion how to control children from not taking junk food so frequently."
I think first lesson is discipline. If as a parent you make it a rule in the house that this is all is our quota for the month, it's your choice. You eat it once, or you just divide it over weeks. Be very strict. Then portion control. So whenever they eat chips, then have it in an open bowl. So you will figure out, like, if you open the whole chips and put it in bowl, it will be way lot. So it will trigger to them, we are eating a lot of junk. Okay. And
Mhm.
show them videos. If they're younger children, show them videos of dental caries, germs. There's a lot of informative videos. But I think
Mhm.
you are the only one who can get the junk food at home. So if you limit that, and you have to be a good role model, so it can't be like you are having pizza but you don't want your child to have pizza. So there'll be a lot of family. As a family, you will have to come together in regards to what kind of lifestyle we want for ourselves and for our children. So what me and my husband do is, we don't keep chocolates at all in our fridge, Dr. Hassan. So we just get it. So it will be just a weekend event. We will get it and we'll eat it, and that's about it. Or if we want to eat it over the week, we just like take a piece of it every day. So
Mm.
yeah, and have
So come
healthy
on,
conversation.
you're okay. So come on, you're telling me to sacrifice pizza? No way. Anyway.
So not sacrifice, it's just having limited amount. Or and then go for healthy choices. So a lot of my patients love Maggie, but there's an instead of maida, go for atta Maggie. Go for they love pasta. So go for
Okay.
wheat pasta. There are legume pastas, pulse pastas. So make the food in that the how it looks, but just go for healthy choices.
Okay.
Yeah.
Okay then. Someone said, "This is Samira Mahfouz. Oh, she's my friend. She says she follows every life of mine. What the live I do, she follows it. Thank you, Samira. And let's get back to questions again. When the vaccine will be available of the
Oh,
COVID?
that's a multi-million question. So a lot of candidates vaccine. There are big ones from Oxford. There's one from in a couple of them in US, and then we have our own. Serum is leading it. Uh, so I think a good vaccine basically requires. So initially, good vaccine used to take years, but now we've been able to, speed up the process. But the most important step, which is currently the phase 3 clinical trial, right, where you are basically giving it to a multiple large population, following it up in couple of months to see if there are side effects, or is it developing enough antibodies to protect us for long time. So that is the most important phase, and that usually takes a year or so to really give us good results. So I would say in totality we are looking at mid next year, 2021, or probably end of next year, when we'll have our vaccine available. And I think the best and the cheapest vaccine right now is wearing a mask and maintaining that 3 to 6 feet distance. So I don't know why
Okay.
people love
Okay.
spending money, and that's the only way they realize that okay, I am doing something for myself, and that's what is protecting. But I really want to push this fact that please, a cheap thing could be also a good thing. So wear a mask and maintain that distance, social distancing.
Okay, okay. So actually, what do you think the vaccine will really work because the virus is changing its character every day? Like in Bangladesh, we have the Italian versions. The virus has its versions. Like we have the
Yes.
Italian version of the virus. Maybe India has another version, like Chinese version is there. So what do you
Yes.
think? The virus will, I mean, antivirus will work, anti-vaccines will work. What do you think?
There are a lot of subtypes which have been identified for this virus, but there's a
Mm-hmm.
particular protein spike which is very common to all viruses,
Okay.
all the subtypes. So most of the candidate viruses are working on that subtype.
Mm-hmm.
So to produce antibodies to absorb that infection based on that subtype. So the some of these candidate vaccines are very very promising because that subtype is common to most of the because that spike protein is common to all the subtypes. It should cover most of the viruses subtypes available.
Okay. So what is the role of specialists like you? Are you keeping the data and are you keeping the things that will be helpful?
So I studied in Texas Children's for 3 years, where I
Mhm.
used to manage complicated infections. So in ICUs, kids with recurrent infections. So they have
NICUs,
some long
NICUs. You're telling about NICUs.
NICU, yeah. So in neonatal infections, the ICU infections, there are kids who have immunity disorders. So they keep having infection one after the other, growth failures, complicated TB. So we know in Bangladesh and in India, there are a lot of resistant TB
Same.
bugs. So those I'm expert of managing those infections. Then I had cases, ever since I moved to India, then we have these cases which we call fever of unknown origin. So the child keeps spiking fever, otherwise doing well, but every 2 3 months, or a fever lasting more than 2 to 3 weeks. Those cases I'm providing video consultations to figure out the whole story and help them determine why it's causing the fever. So I'm kind of like second opinion fever doctor is what people call me sometime here. And then I had cases coming from Yemen where they had very bad infections spreading like anything in their body, needed multiple surgeries. And in those cases I helped them manage that infection with proper use of antibiotics. So that's another forte of mine. So any complicated infection which is not getting better, or recurrent growth failure with recurrent infections,
Chronic,
I'm
chronic cases.
available for video consultations. And if I feel the patient needs to be moved to Bangalore, then we are doing that with collaborating with people aboard.
Okay. Please tell me the next question comes that, can you tell me how to fix a teleconsultation with you? How
Yes.
to reach you?
Sure. So there is a Hello Doctor app, an online service through Rainbow Children's Hospital, and
Mm-hmm.
I think there's a helpline number as well, which you can call, and that way it's very easy. You just anybody typing infectious diseases or infection doctor, my name would pop up. I'm available in Bangalore. I'm available Monday to Saturday, 9 to 5 p.m. And fortunately, we are pretty much on the same time zone. So
Yep.
any patient, family, physician, pediatrician who want to know more about infection or have a complicated case where they're not able to manage, or COVID related queries, can make up an appointment with me and seek medical consultation.
Okay. That's wonderful. That will be so helpful. So thank you, Dr. Manu Choudhury, for your valuable time. And this discussion was so informative, and hopefully it will be so helpful for our viewers. Thank you so much.
Thank you, Dr. Hassan, for inviting me.
Thank you so much. Take care.
Everybody take care. Yes. Bye.
Take care. Take care. So viewers, thanks for joining the live. If you anyone want to contact with Dr. Manu Choudhury, you can if you want to have a teleconsultation with her, it's possible. Just let us know. And as she told that there's some link of the Rainbow Hospitals India, you can contact her directly over there, or you can ask us, then we'll fix the appointment with you. Or I think it was so helpful. Thank you, viewers. Thanks for joining. Thanks a lot.